Okay, I think that's probably close to the number we were expecting this afternoon. So I think I'm going to get started if that's okay with you, Andy. Brilliant. Actually, that was the last person I was expecting to just appeared. So that's perfect. Okay, thank you very much for joining us, everyone. Hopefully you can see our opening slide for this afternoon. My name is Rachel Pryor. A few of you may already know me from various other LEAP activities, but just in case you don't, I'm the manager of the LEAP Digital Health Hub. I'm based out of the University of Bristol, and I'm joined here today by a few of my colleagues on LEAP. Christos Vasilakis, who is from the University of Bath. He's one of the fellowship co-directors and just gave a bit of a wave there. And Professor Andrew Drazi, also from the University of Bristol, and another one of the two fellowship co-directors for LEAP. So it's a real pleasure to be having a little bit of a chat with you this afternoon about our latest funding call or scheme. I think it's a little bit of a more unusual one than our previous schemes. So really excited to go through this with you today. This is one of two info sessions. The other one took place earlier this week. A bit of a plan for the session, if I can get the slides to move on. So we'll run through a little bit of housekeeping here. We've got about 20 minutes of slides, so hopefully nothing too onerous, followed by lots of time for questions. It more than likely won't take the full hour, but we'll stay as long as you guys have questions for us. So please do have a think about them as you go through these very simple slides. For now, please do keep your mics on mute just whilst we're going through the slides, but feel free to add questions to the chat. And I think there's also a Q&A, so that I'll have to keep an eye on both of those. So pick your place to add your question, and I'll hopefully be able to run back and forth through the two of them. At the end of the little talk here, if you'd like to actually talk to us, you're very welcome to. Please just pop your hand up in Teams and we will get to you in the order that they come up. You've probably spotted that this is being recorded this afternoon, so the intention is to put one of the two sessions on our website for other people to see who might be interested in finding out a bit more about the call, and we'll be sharing it out for anyone that couldn't attend the call, the info session this afternoon. So please do just keep in mind that it's being recorded throughout the session today. In terms of a plan for this little hour that we've got together, I'm going to very briefly run through a little bit about LEAP. Apologies in advance if a few of you have been to any other activities of ours and heard this before. It might look very familiar, but for some of you it might be some new information. I'm then going to hand over to Andy. He's going to give a little bit of an overview of this particular Community Innovators call, and then we're going to come back together for a Q&A session at the end. Okey-dokey. So on to my first slide here. I'm just going to pop you on mute if that's okay. There we go. So a little bit about LEAP, as I said, we are one of 5 digital health hubs funded by the Engineering and Physical Sciences Research Council, which is part of UKRI. We are aiming to cultivate a multidisciplinary, entrepreneurial, cross-sector digital health community in the southwest of England and Wales, which is the region that we cover as a hub. And we're doing this by providing lots of opportunities, like the one we're here to talk about today, in research and collaboration through 3 programmes and a very wide partnership network. Some of you are already part of that and may be well familiar with it. Our key objectives for the hub are addressing unmet health needs, health and social care needs, importantly across the southwest of England and Wales, connecting industry, academics and health and social care providers across the region, and increasing the capability in digital health in our region through opportunities for training, research and innovation. This slide just shows a little bit of our patch that the hub covers. There are a number of logos here, but that doesn't cover the full extent of our partnership network, which is very broad. We had 60 founding partners when we started the hub 2 years ago in October 2023. And there are 5 universities that make up the academic side of the hub. That is the University of Bristol, University of West of England, University of Bath, Cardiff University and University of Exeter, plus HDR UK, Health Data Research UK, who are a national institute. We also consist of 12 NHS trusts and Welsh health boards, 21 companies, and there are quite a few more now joining on board with the hub as we go along, and 4 social care organisations. Like I mentioned, we've been growing quite a lot, and our network is now well over 200. I think it's coming on close to 300 organisations. So thank you very much for being part of that. I'm going to very briefly talk about how the hub is structured, so it can put some context around this particular call and where it sits. You may have come across our skills and knowledge program. So LEAP, on our website, we have a training library, which is full of courses and CPD learning from across all of our partners. So these are all developed various pathways for industry and healthcare professionals in digital health. We have a fellowships program, which is what the program that this particular course sits underneath, which is piloting a number of different schemes aimed at different groups of people, through which we're hoping to develop future leaders in digital health, and as also a chance to bridge sectors and disciplines across those leaders. And finally, we have a research program, which is made up of 4 strategic research themes, which Andy will go into a little bit more detail when we talk about the scheme itself. And through that particular program, we have been funding research in these themes, which is very collaborative, and there's about 10 research projects funded on LEAP as things stand. A little bit about sort of other activities that LEAP is involved with. Many of you may have been involved with our festival Digital Health over the summer. So we run quite a few events aiming at bridging those different sectors across the region. At the Digital Health Festival, we had 12 events across 4 cities, with close to about 700 participants actually across the region. It was a really excellent week of events. We had nearly 250 different organisations involved across 11 regions of the southwestern Wales coming along, and had a great range of events, from leadership summits to co-design workshops and hands-on training in various skills in digital health. And we had some very good feedback from everybody about how we're using those festivals and events like that to bridge sectors across this region. So thank you for anyone who did join at that over the summer. I'm now going to hand over to Andy to go into a little bit more detail about the Community Innovator scheme itself.
Thank you very much, Rachel. Welcome, everyone. So we were discussing on what ways we could bring in the community into our digital health research and development partnerships, and we've come up with this scheme. So the aim, as I say, is to bring lived experience to the heart of digital health research. Next slide, Rachel. And so this scheme is designed for people with real-world experience of health and care in the community. The idea is that you, through that lived experience, would put forward a health challenge, whether that is from your own experience as part of your job in the community, or as part of your community, that you think you could be solved using digital technology. I'll get on to in the next slide what we mean by digital technology. And what we will assist with is that we will work with the successful applicants to co-develop their ideas, and hopefully turn your ideas into impactful digital health research and innovation. And we will provide support to you through training, mentoring and collaboration. We will pair you up with one of our researchers to discuss that and those needs. And then the aim is that we will then help you through a community sandpit event, form a team that can apply for £10,000 of seed corn funding within our university network to develop the idea further, which could be a proof of concept, or it could be just establishing the feasibility for a solution. Rachel. So it's always quite difficult what to pin down what is exactly digital health. So we'll give you a few facets of it here. Particularly, we have 4 themes within the hub, which are listed here. Your idea doesn't have to fit exactly into one or more of these themes, please come to us and discuss through the application process what you're thinking about. Although I will say that we will need to, at some level, prioritize things that are related to these four schemes. So digital health means using technology to look after our health and improve health and social care. Our ultimate goal is to make healthcare easier to access, more personal, and better at keeping healthy. So our first theme is care outside the hospital. So these could be digital tools that help people stay well at home, help them avoid unnecessary hospital visits. Things like virtual wards, so they can be at home instead of hospital, online check-ins, or even new services in local spaces such as pharmacies or community centres, etc. Our second theme is service and resource planning, and this is to help our healthcare services with their struggle against limited staff, space and equipment. So how can digital systems help better make better use of these resources through planning staff, managing patient flow, coordinating services more effectively. Thirdly, is frailty, fall prediction and prevention. This is one of the main reasons why older people end up in hospital. And so digital health tools and things like this can help, like wearables, for instance, can help predict and prevent falls potentially, and therefore support older adults to live independently at home for longer. And then obviously very much related to this, but also to all our other themes and in general, smartphones. What can we do to enhance our use of the smartphones that most people have and wearable technologies, such as watches or even video tools? So this could be monitoring heart rate or sleep, to helping carers keep tabs on who they care for. These can be powerful in the right people's hands. Rachel. So then there's question of eligibility. Can you be a community innovator? So we're hoping to cast a broad net here. So one thing we do is a requirement because of our hub being part of the being focused on the Southwest and Wales, that it is a requirement that you are based in the Southwest of Wales with lived or frontline experience of community health and care. You can certainly partner if you have partners already that aren't based in the Southwest or Wales. That is fine, but you should be based in the Southwest or Wales, and the tool needs to be applicable to people in the Southwest and Wales. So this might include people who are involved in community groups or charities, work in social care or assisted living, but of course also patients, independent patients who may have lived experience, and informal carers too. One thing that's key is you really don't need a research background or technical skills, just a problem you care about solving and a passion for making things better. We're here to provide the support and the research and to start building those collaborations that can help your ideas be realized. So at the bottom there, in case you're an academic on the call, you are not eligible to be a community innovator yourself. But the point is that we will invite relevant academics, NHS and industry to the community sandpits, where hopefully you will find and interact with people, that you can make up a team to apply for the £10,000 funding. Rachel. So to be more specific, those that are successful through our first application process will be partnered with a lead researcher, and we'll introduce them later on in this information session. And then on one-on-one, you'll discuss with them to shape your idea into a during a short meeting in October. That will be a pitch that can be given at the community sandpit event that will be in early November. And whether you give this presentation at the sandpit or the lead researcher does, that's purely a discussion with yourself and the lead researcher. But at the sandpit, you'll be presenting your ideas to the attendees, as I said, academic researchers, NHS partners and industry experts, and we'll be giving you the chance through breakouts on tables to discuss, to introduce you to these people and discuss with them expansion of your ideas. And from that, we're hopeful that you'll with the team be able to write a short application to a call that will give you or give the academic with you £10,000 of funding to be able to develop the idea further through the first 6 months of next year. And as I've alluded to, you'll also have access to mentoring and guidance, free access to our skills and knowledge program, and the opportunity to make use of our co-working spaces and resources at our 5 partner universities at Bath, Bristol, Cardiff, Exeter, and the University of the West of England. Rachel, I think it's back over to you now, I think.
Yeah, I think you're right. It is me now. So this is the slide where we were just wanting to quickly introduce you to the research team within LEAP, who will be the ones that you would be partnered with if you were successful to be one of our community innovators. So I'm just going to run around. I think all 4 of them are on the call, but I might be wrong. I think I can see them. So I'm just going to run around you, and if you don't mind just saying hello when I mention who you are, that would be brilliant. So first of all, we have Matthew Ragg, who is one of our experts on sort of software development HCI. Matt, do you want to say hello and unmute?
Hi everyone.
Thanks very much, Matt. We have Emily Nielsen, who is also an expert on human-computer interaction. Emily.
Hiya.
Thank you very much. We have Mikel Nieto, who is one of our data science and AI experts. Mikel.
I should say hello.
You say hello. I mean, you can say a little bit about what you do as well, but everyone's just to say hello so far.
Yeah, well, basically working on machine learning, artificial intelligence, and how it can be applied into healthcare.
Brilliant, thank you. And Naweed Keshmand. Naweed, I can see your name, your initials. There you are.
Hey guys.
And so Naweed is also an expert in data science and AI as well, along with Mikel. So a really great team for you to draw on, and we will, as Andy alluded to, partner you up with a relevant person, and they will help develop your idea in the lead up to that sandpit in November. There is an email address here if you would like to ask them any questions or have a chat about it beforehand. Okey-dokey. Right, next slide. So a bit about the application process. Hopefully this is quite straightforward. So the applications, there is a very simple application form open right now, which is the one to become one of our Digital Health Community Innovators. Successful applicants will be partnered with one of the 4 researchers we just introduced you to develop your challenge for the community sandpit event. Second stage of this, as Andy's mentioned before, these successful applicants will then form a project team at our community sandpit event, where they will be able to apply for the £10,000 of CCORN funding. There is a little bit more of an explanation about what CCORN funding is on our website, but essentially, as Andy mentioned, this is about trying to start the idea growing, so like a seed. So you might have an idea that you'd like to test the feasibility of, proof of concept, with the idea that eventually you'll be able to apply for further funding further down the line with your project team to expand the idea further. The short form is linked here. There is a QR code as well. All of this is available on the website, and the slides will be shared afterwards. But if you did want to have a little look at what is involved in the form, you could have a scan of that QR code now and have a run through it whilst we are chatting. So a bit about the timeline. So the scheme is open now, the first stage of that, the Community Innovator side. That was open last week. We are having our online information sessions as we speak, and these will be available, as I said, on the website if you want to refer back to them. The application form will close on Monday, the 6th of October, and then successful applicants will be notified on Monday, the 13th of October, and that week we will be setting up meetings with each of the researchers for those that you are partnered with if you are successful. In the week commencing 3rd of November, successful applicants will be invited to the Community Sandpit event, and the sequel application, which will also be quite light touch, will be opening for the project teams formed to apply for that £10,000 of funding. On Friday the 28th of November, that application will close, and then in mid-December the awards will be announced. A few quick additional details. So there will be about 5 to 10 successful applicants for the Community Innovators in that particular first stage of the application process. So 5 to 10 Community Innovators will be invited to that Sandpit event in November. Successful applicants will be, as I mentioned, notified by Monday the 13th of October. Funded projects will be up and running from January to July 2026, so they'll be about 6 months in length. Near the end of your project, you and your team will be invited to a workshop where we'll give you a little bit of information about how best to apply for further funding. So a little bit of a guidance on how you might want to do that for different funders. Particularly, we are, as a hub, very focused on EPSRC. That's where our funding comes from. So we have quite a lot of expertise in that area, but we'll be able to give you some general guidance about developing a further funding application. On our website, you'll be able to find the call information in various other languages, in Welsh, Polish, Somali and Arabic. And if you have any questions that you think of after today's session and you'd like to ask them to us, please do email the hub mailbox, which is this address here, and you can reach either myself or my colleague Emma to get an answer about any questions that you might have as you build your application. And now is your chance to ask applications live to us here today, so please do speak up. I'm just going to stop sharing so I can see what questions might have come in, and I can see there's something in the Q&A.
Yeah, there's something from Miguel.
Yes.
Who is considered to be an academic.
Yeah, so we mentioned that academics are not allowed to propose a project. Could you clarify what is considered an academic in this case? Are postdocs or postgraduate students considered? Yes,
that's a good question. We haven't discussed it specifically, but so we might have to, unless I forget that we discussed it. But Rachel, do you remember? Andy?
Well, I think
go on, Rachel.
So I think that the remit of this is for the Community Innovators to not have a research background. So I would say that the term academic will stretch to postdocs, to postgraduates who've got research training. Specifically, we're trying to include people that might not have that background to be able to enable them to be part of this. Andy, did you want to add anything to that?
No, but I'd say that that first and foremost, it's about the lived experience. So I'd suggest we may not exclude a postdoc who had lived experience and was researching something completely different from digital health, for instance. Yeah, I would put that caveat, and I would welcome them to apply. But yeah, we should prioritize those in the community with lived experience. That's what the call is for.
Yeah. I can imagine somebody who has a strong lived experience of particular as a carer or as a patient. Perhaps we want to look at it individually, the case. But if it is a research project idea from a postdoc, I think we wouldn't qualify this as a as a lived experience, because that will be on the research side of things rather than the first person or care perspective.
Yeah, I think that's fair additional. But as we've mentioned, you know, we do really want people to come along to these Sandpit events if they are from that background and do have a research idea like that. So please do come to the second part of that. That's a really great question, Mikhail. Thank you. Next question that popped up in the Q&A. Would it be okay to re-show the slide about eligibility? Yes, it will. Give me 1 second. As I sort of mentioned earlier, we will absolutely be sharing these slides back with you. Also, they'll didn't like that. There we go. Nope. Here you are. Michelle, did you have a particular question about the eligibility? I'm happy to answer. You're very welcome to unmute and ask if there was something in particular on the slide you weren't sure about. Okay, I can't hear anything else from Michelle, so I'm hoping that that's helped a little bit. Having listened.
Having listened, I guess, having looked at the slides, Michelle doesn't think she qualifies, but we can happy to discuss this if or offline if you prefer that way, Michelle. But the key here is that it has to be a Southwest or Wales link. You know, we have the inquiries from different countries, you know, and it's something that it's beyond the remit of our funding. We're focused in the Southwest and the Wales, and the lived experience that we mentioned a number of times is key, and an issue that is amenable or can be addressed by digital health rather than anything and everything. Otherwise, the remit will be too wide. And given that we are a digital health related hub, I think these are the three keys. The three key points of eligibility.
Yeah, that's brilliant. Thank you very much. Thanks for that question, Michelle. I'm going through the Q&A first, and then I'm going to hop over to the chat. But great to see there's plenty of questions. Peter's asked, are you excluded if you've already started? So I guess, Peter, does this mean that you already have a project underway that you would be interested in continuing through this scheme?
That's it, yes.
Yeah. I think this probably would fall back into a similar thing that we said with the different backgrounds side of things, which is, I think it would be a bit of a case by case. I think we'd welcome for you to apply if we've already got something underway, but you have something you'd like to expand a bit further. Andy, Christos, what do you think?
Well, I haven't got it working yet, but I've done quite a bit of research in how to make it work.
I think the kind of my first reaction would be, I don't think it should be disqualified someone who has started doing some work now. If that was a multi-million-pound research project, probably yes, it will. But if it was something that, Peter, you took it on upon yourself, and you might, I don't see the reason why we would have an issue with that. But you can Andy.
Oh, sorry, but particularly if there's clear value in partnering with academics, NHS and industry to achieve it. Yeah,
I think clarifying what you've done so far and why you need leap support through this scheme, I think that will do very nicely.
Yeah. Great. Hopefully that answers the question, Peter. Okie dokie.
Yes,
so
thank you.
Great, thank you. So Peter, is it one £10,000 fund to be shared, or is there only one winner? That's a really great question. So I think Mikhail has already answered it. So each successful project would get £10,000 of funding each. There is a total pot, which this would be sort of broken into. So I think that there will be 5 to 10 of these projects. Each could get £10,000.
Good.
Or support of the equivalent value of, to be more precise, rather than cash, as we say.
Yeah, So it's probably worth also, and there will be a little bit more information about how the funding is set up and works in the next stage of this application process. But this will be funding in the way of usual research funding. So this will be looked after by an academic at one of the universities. The funding can't be used for salaries or that sort of thing, but it can be used to perhaps do workshops or some prototyping to develop the idea further, if that makes sense. Anything to add, Andy, Christos?
Yeah, thank you. Yeah, will it go on? I mean, can it actually get involved in marketing a product if we get something running?
I mean, I think if you really, this is generally for the feasibility, I think, stage of things. I think if you're at that stage of marketing,
I would say that we are generally looking for early stage research and innovation. Our hub is very much on that link from the earliest stage to the first stages of innovation, and then there are, I guess, other schemes that potentially would handle after that.
Okay, thank you.
Great.
There's one more question in Q&A, but there are quite a few questions in the chat. So should we finish off the Q&A questions as you started, Rachel?
I think I might just continue with the Q&A. Yeah, just to stop hopping.
So yeah, the Q&A question is by Christopher. Says, if we plan to conduct a project outside UK, specifically Uganda, is there any support we could get from the hub? Well, as we've kind of clarified, our focus is the southwest of England and Wales. So if the project cannot demonstrate, if the proposal cannot demonstrate actual links to the southwest or Wales, then I'm afraid we won't be able to fund this. Now, it could be that the same product, the same idea can be obviously applicable in different national or other geographical contexts. There's nothing wrong about that. But I think if the focus is, if there's no good connections with the geographic location we just mentioned, I think we'll be beyond the remit of our funding and of our hub. Andy, Rachel?
That sounds good.
No, I think that's right. At least, yeah, the current sort of size and scale of the hub, we have to limit it to the region that we're in, really. But I guess in terms of other support that we can offer, I don't think there's any sort of funding that might sort of come under that area, but certainly some of the events that we run, some of the training that we have could be of interest, and isn't necessarily restricted or based on where you are. So please do have a look at that. Right.
Quite a few questions in the chat, starting from Catherine's in relation to age limit. But you have an upwards or downwards age limit in mind, because obviously, I don't think, we have an age kind of, I guess that does, if you're good enough, you're old enough, probably applies here too. So no age limit, I would think, other than toddlers, probably.
Right.
Are you able to share an example of a previous project under this umbrella? Well, the short answer to that is no, because that's the first time we run it, and we are quite excited about this particular scheme, because we are kind of we have thought this through, and we've discussed this with a number of stakeholders, and we're trying it out. So no, on the downside, we don't have a previous project or any examples to give you.
I think if you were interested in hearing a bit about the projects that fall within our research themes, Mel, we have got a number of projects on the website that have been funded through LEAP that are obviously on quite a bigger scale. If you'd like to see some examples of some of the technologies that we have been researching so far in LEAP, and we're very happy to run through a few examples of that. If you'd like to have a chat about that, please do send us an email.
They're very
Rachel, I
researchy.
did have a look.
Sorry,
I was saying thank you. Yes, I did have a look through those, but I thought they were quite sort of high level. So I was wondering if, as this is community innovators, which basically people with a lot less experience than obviously your team, you know, I was wondering if there was an example. But yes, if it's the first time you've run it, it makes sense. Thank you.
I would just add, don't be put off by the examples of the research projects we have put on the website, because these are very researchy, quite advanced. You know, some of them have already some work behind them. So, you know, the community innovator scheme is, you know, we don't expect people to come with really advanced research level ideas. You know, there's the whole idea is we're going to provide some of that support to take it to the ideas to the next stage.
Thank you. Yes, absolutely.
I have a question from Jan, who says, if we have a project already happening, but we would like to expand our reach by increasing the digital options, such as introducing an app and having the research behind us to be able to offer through the NHS, is this feasible?
So my opinion is, yeah, absolutely, but potentially. Again, I think it's about how the hub can add value to that, and how our expertise in digital health can help realize that.
Now, I guess my question also would be, who is we that have already the project happening? If that we is a research team with a backing of a company, probably, you know, it's going to be out of remit for the community innovator scheme. But I can imagine that, but by we, you mean a group of individuals rather than, you know, some sort of more concerted effort. So yeah, then what Andy said applies to this question, I think.
Hi, Christoph. Yes, it's Leanne here.
Hi.
It's a service, and it's a social enterprise, and it's all led by people with lived experience. But we are wanting to get taken more seriously by the NHS, but we don't know how to do the research aspect of it. We're doing the qualitative and quantitative data, but we don't have the, you know, the experts in understanding how to present this kind of information. So, I mean, really, this project looks absolutely perfect for us. So I'm definitely going to apply.
Yeah, it's a big challenge, and you know, big companies with a lot of resource behind them or big research teams, they still struggle to cross the valley of death, as I've heard them being called. So, but that doesn't mean that one shouldn't try. So, yeah, I think we'll be more than happy to look into this and with a view of, you know, shortlisting it and you know, having as one of the innovators. Yeah.
Thank
you. I think there is also the Uganda that we answered. What kind of commitment could a community innovator expect to contribute over 6 months if funded successfully? Mel asks. It's a very reasonable a question. I think somewhere we've highlighted that for those successful, or for those especially funded after the Sandpit kind of event, we expect, what was it again, Rachel? A few hours per week?
A few hours per week, I think. It's not designed to be a full-time job for sure, and it's also, you know, it's meant to be something that can be done sort of in spare time, and yeah, a couple of hours a week would be the maximum we'd like to see put in for that.
Okay, thanks. I mean, I guess I'm asking questions that are kind of PPI driven, because that's the field that I'm coming in the angle from, and I know I'll get asked these kinds of questions if I share this as an opportunity with a patient network of people with lived experience. They will ask things like, you know, time commitment, and is there any funding, you know, travel expenses, that kind of thing. So those are where my questions are coming from.
Yeah, absolutely. And that's a really useful question to ask. I'm hoping that we've got So I should say, this is probably a good point to say this, that on our website, on the web page that we have, we are building an FAQ that will add these kinds of questions as they come in. So if there's anything that's not already on the website, we will make sure that it is on the website and answered so that everyone can see that. But yeah, that's a really great question, along with the travel costs, and hopefully that is already on the website, that we will cover travel costs within the Southwest for community innovators trying to participate in the scheme.
Yeah, it'd be great to have an FAQs page that I can just send people to if I get asked, if I've sort of passed on the opportunity. I mean, it sounds great, don't get me wrong, it sounds absolutely great, but I know that these are questions I'm going to get asked. Absolutely. Yeah, that's really helpful, Mel. Thank you very much. Okay.
There's Catherine also that is asking, do you provide any guidance on improving projects submitted that may be needing improvements? I'm not entirely sure if, Catherine, you can clarify if you are still on the call and you have access to a microphone. But if you mean proposals to become community innovators, then I think there's not enough time to do so, because the deadline is coming up and then we have to have a quick turnaround. But in terms of once part of the community, once part of the select projects, I think part of the work that we're going to be doing with the community innovator, with the research team of LEAP, will be to help them improve ideas and take them to the next step. So no and yes is the answer to that.
Fantastic. That was a really good number of questions. Are there any others that I've missed, or if anyone has any last ones, please put up your hand or add it to the chat now.
I hope I haven't missed any as I was going.
I don't think so. I've been trying to check it as well. This is always the problem.
I think we haven't.
Great. Can anyone be added to the LEAP Hub mailing list to get future updates? Yes, you certainly can. Probably the easiest way to do that, when we share the slides, we'll have a very obvious button where you can sign up to our mailing list. I should also say that in the application form to become a community innovator, there is an opportunity to sign up to the mailing list there as well. But yes, Mikhail, that's also a great question. And please do email the Hub mailbox if you do have further questions that you'd like that are a bit more complicated than we're able to go through here. Very welcome to take any queries as they come in, and we will be sharing the slides afterwards, so please do have a look through them again, and if there are further questions afterwards, then let us know. Brilliant. Okay, thank you very much. I'm sure you've asked me. Yes, I think, Catherine, yes, we will be working with the innovators to further develop their proposals, and as the projects go on. So yes, there will be support on that as it goes through. So fantastic. I think without further ado, I think that's probably the end of the question. So we'll probably call it there. But thank you very much, everybody, for joining us. And you'll probably see a recording of this on the website at some point if you want to watch it back. I hope to see some applications coming from you all, and really look forward to seeing what you guys come up with. So thank you very much.